Good day, everyone. First of all, I'd like to thank APRN and LSPR for inviting me as a speaker in this PR Coronavirus Webithon Series. I'm really honored to join you today. I also note that this Webithon Series is being held to support COVID-19 victims, especially families of children with special needs and autism. I'd like to commend the organizers for this wonderful initiative. Today, I would like to share with you my personal perspectives, views, and thoughts on COVID-19 with special focus on the Philippines and ASEAN. Since the World Health Organization declared it as a pandemic in March, COVID-19 is still unfolding and affecting communities around the world, and it's unprecedented in scale and unimaginable in terms of the damage it causes to lives and our way of living. Even as I speak now, the loss of life and suffering caused by this pandemic continue to affect people and societies around the world. We therefore should commend our medical professionals, our healthcare workers, and other frontline personnel in their efforts to prevent, detect, control, and respond to the spread of COVID-19 and address its severe and multifaceted challenges. Indeed, in the time of COVID-19, the complicated nature of this pandemic needs unprecedented response from everyone. This is perhaps the most serious challenge that we are facing in a generation. But I'm very confident that we will overcome it with cooperation from everyone. COVID-19 has affected almost every country in the world. And just like any other nation, the Philippines continues to suffer from the effects of this pandemic. So the government is prioritizing the well-being of its people in the fight against COVID-19 by providing appropriate support to people affected by this pandemic. In response to the growing threat of this coronavirus, the government has established the Interagency Task Force for the Management of Emerging Infectious Diseases. This task force has the following functions: the overall management of COVID-19 preparedness and response, the consolidation of updates and information related to COVID-19, and to ensure government's transparency and accountability. This task force also conducts regular press conferences and dialogues to inform our people, the Filipino people, on the latest updates on the fight against COVID-19. The task force has also established quarantine areas, especially for returning Filipinos, overseas Filipinos as well, including visitors, where they are immediately checked and examined upon arrival at the airport for COVID-19. Overall, the main purpose or the main goal of this task force is to protect the country and the people from COVID-19. The Philippines has established various quarantine measures throughout the country so that everyone will be properly protected against COVID-19. And again, just like any other country in the world, the Philippines is also preparing for what we call the new normal. So in anticipation of these changes that continue to affect our well-being, our societies, our way of life, the way we work, the way we interact with people and colleagues and even friends and families around the world, the Philippine government, I think, is focusing on at least 4 areas. Number one, again, it's still this pandemic continues to wreak havoc. So the Philippine government is prioritizing the production of vital medicines and medical equipment and supplies, and enhancing the capacity of the healthcare systems in response to the increase in infection. As we speak now, I think just like any country, for example, in the ASEAN region, the Philippines continues to experience some spike in the number of COVID-19 cases. And number two, the Philippine government, I think, is also prioritizing to ensure food security. And this is very important. Food security will ensure the well-being of the people. Especially, I think the government is prioritizing the supply of rice and basic commodities. As you know, rice is the staple food of Filipinos. We cannot eat a meal without rice. So this is a very important supply that we need, lockdown or not. So as I said, this is just to ensure the well-being, the safety, the good health of our people. And number three, the Philippine government also continues to cooperate in the development of vaccines, and also in enhancing through the enhancement of research and development. As our president said, without a vaccine, perhaps we cannot return to the old normal. So we all anticipate, we all pray for the development of that much needed vaccine to defeat COVID-19. And of course, also, this is perhaps not the last pandemic that we will encounter in our lifetime. So the Philippine government is also preparing for future outbreaks. And preparing means enhancing the capacity of the Philippine healthcare system, the improvement, the development, the technological improvement and enhancement, capacity building of our doctors, our professionals, and also overall our hospitals and our healthcare systems. From a national perspective, I'd like now to go to a regional perspective in the fight against COVID-19. So it's basic. This is just a huge challenge to everyone, unprecedented in scope, in scale, in the effects that it has brought and continue to bring to our societies and lives. COVID-19 is just not an ordinary enemy that can be defeated alone. So we cannot do it by ourselves. So we need cooperation with the international community, especially within our region through ASEAN. So this fight needs collective efforts of the international community, regional organizations, and various stakeholders. In the recent special ASEAN summit on COVID-19, I think that was early in April, I note that the ASEAN leaders pledged to remain united and vigilant against COVID-19, and they committed to work closely with the World Health Organization, the ASEAN's various external parties and partners, the international community, and other stakeholders to suppress the pandemic, protect people's lives and livelihoods, and maintain socio-economic stability in the region. So I think it's a good sign actually. It's a very strategic gesture from ASEAN as a regional organization as a model of regionalism to respond collectively to COVID-19. So as a strong member of ASEAN, the Philippines has supported ASEAN's response to COVID-19, which is perhaps characterized by a multi-sectoral approach, also a whole of community approach among ASEAN member states, and of course with its external parties, including its dialogue partners. So we note that ASEAN continues to strengthen a collective response to COVID-19, against COVID-19, by using existing mechanisms and platforms, especially those under the health and development sector. But again, COVID-19 is an issue that is maybe multi-sectoral. It's a cross pillar. In the ASEAN language, it's called a cross pillar. So it also demands, it also needs cross pillar, cross sectoral action against it. So if you notice, ASEAN has been mobilizing almost all its resources, all its existing mechanisms across the political, socio-economic, and even the economic community platforms. So I think you have noticed that there have been series of high-level meetings between ASEAN and its dialogue partners. Also, I think you have noticed and perhaps read in the news, in the newspapers, and listened from broadcast reports that ASEAN continues to engage with among themselves, among ASEAN member states, and with dialogue partners. They have been doing a lot of meetings across various platforms, especially through video conference as well, with dialogue partners, with external parties, and even with experts. Because the fight against COVID-19, as I said, will not be defeated alone by a single country or a single organization. It involves a multi-stakeholder approach, a joint efforts, collaborative undertakings by various stakeholders, by countries. So ASEAN has been consulting with its dialogue partners up to the highest level. I think they have done the ASEAN Plus 3 Special Summit, and in the next few days, ASEAN will also have its regular ASEAN Summit, again to look at its preparedness and response against COVID-19. And what I can say is that the Philippines has supported all these initiatives. So what are the proposals being initiated or undertaken by ASEAN as of now? So right now, in response to COVID-19, ASEAN is trying to establish the ASEAN COVID-19 Response Fund. This will procure essential medical equipment for health emergencies and personal protective equipment or PPE for our health workers and for our frontliners. Second, ASEAN is also trying to establish the ASEAN Regional Reserve for medical supplies. This will be for the procurement of essential supplies, including medicines, in preparation for future public health emergencies. Another important initiative is the possible expansion of the mandate of the AHA Center, or the ASEAN Coordinating Center for Humanitarian Assistance. I think you have heard about AHA Center. Specifically, its mandate is actually just to respond to natural disasters. So ASEAN has to adapt, and perhaps the AHA Center also has to adapt in view of the rapidly changing situation affected by COVID-19. So if we can expand, or if we can tweak the mandate of the AHA Center, the AHA Center, it can also be used to respond not only in times of natural disasters, but also during public health emergencies. This could also open the possibility of using existing AHA Center warehouses in Malaysia, in Thailand, and in the Philippines to stockpile on PPE and essential medical supplies. In addition, ASEAN is also, again, in response to this COVID-19 challenge, ASEAN is also in the process of undertaking a feasibility study on the establishment of an ASEAN Center for Public Health Emergencies and Emerging Diseases. And this project, this multi-stakeholder project, this cross-sectoral project is fortunately being supported by our dialogue partners, by external parties, also international organizations, but specifically through the generous support of Japan. In conclusion, I'd like to say that COVID-19, this pandemic has really affected, transformed, and altered our basic way of life, the way we work, the way we engage with our colleagues, friends, relatives, and even loved ones. COVID-19 has affected them all. So this is something that indeed a once-in-a-generation event. And it has it has crossed across all borders, because simply this pandemic knows no borders. It affects and it continues to affect everyone and every country in the world. So our common goal is, of course, is to defeat this virus, not only in our communities, not only in our countries, but everywhere in the world. So the only thing, I think the most important thing that countries are doing right now is to, in order to defeat this virus, this pandemic, is to further strengthen their ongoing cooperation in exchanging real-time information, in sharing best practices, in healing victims, in defeating, in tackling this, in tackling the effects of COVID-19, and also in fast-tracking vaccine development. I've seen a lot of good news. I think I've read a lot of good news about recent vaccine development cooperation across all laboratories around the world. So this is a very good sign of cooperation, and I think this is a good sign that we can eventually defeat this virus. So what can we do as ordinary citizens? What can we do to help in the fight against COVID-19? I think we can do our own little way, our own share to defeat this virus. And I think I can only think of the simplest way, which we can actually do now, and this is to practice social distancing measures. Again, thank you for this opportunity to share my thoughts and views about COVID-19 with perspectives on the Philippines and in the region, specifically ASEAN. To everyone there, let us all be safe, let us all be healthy, let us all contribute our own little way in the fight against COVID-19. Thank you very much.